Most people have never heard of Behcet's disease. That includes most doctors, and that is exactly why people like me spend years bouncing from specialist to specialist. Getting told it is stress, getting told it is canker sores, getting told to use a different mouthwash, while the actual disease quietly does damage that does not get undone. If you are sitting there with weird symptoms nobody can explain, this video might save you years of your life. Here is what Behcet's actually is, why doctors keep missing it, and what I wish somebody had told me before I had to figure it out the hard way.
Behcet's disease is a rare inflammatory disorder. The technical name is variable vessel vasculitis, which is a fancy way of saying it causes your immune system to attack your own blood vessels.
Any blood vessel, any size, anywhere in the body, veins, arteries, capillaries, the brain, the eyes, the gut, the joints. It was first described in 1937 by a Turkish dermatologist named Hulusi Behcet, which is where the name comes from. And here is the thing that makes it so hard to catch. There is no blood test for it. There is no scan. There is no single thing a doctor can point to and say, yes, that is what you have. The diagnosis is made entirely by recognizing a pattern of symptoms over time, and most doctors have never seen the pattern. Part of why doctors miss it is that Behcet's is mostly a disease of the old Silk Road. Turkey has roughly 420 cases per 100,000 people. Iran has around 80 per 100,000. Japan and Korea have it in significant numbers, too. The United States has about 5 to 7 cases per 100,000 people. That is rare enough that most American doctors will go their entire careers without ever diagnosing it. So when somebody walks in with the symptoms, it is just not on the list of things they are looking for. They run through the common stuff, find nothing, and tell you it is probably stress. Here is the symptom that almost every Behcet's patient has: mouth ulcers. Painful mouth sores that come back over and over. Not the occasional canker sore everybody gets. Multiple sores, multiple times a year.
Sometimes constant, sometimes so bad you cannot eat. According to clinical data, 97 to 99% of Behcet's patients have these recurring oral ulcers, and they are usually the first symptom to appear.
The current diagnostic criteria require at least 3 episodes in a 12-month period, but the reality is that most people with Behcet's get them way more than that. If you have been living with mouth ulcers your whole adult life and your dentist keeps shrugging at them, that alone is a reason to ask a rheumatologist about Behcet's. But mouth sores alone are not enough to diagnose it. The criteria require at least 2 more major symptoms: genital ulcers, which over 80% of patients get and which doctors almost never ask about; eye inflammation; skin lesions that look like acne or red painful nodules on the legs; a positive pathogy test, where a small needle prick to the skin develops into a raised bump a day or 2 later. And then there is everything else Behcet's can do. Joint pain, especially in the knees and ankles; blood clots; stomach and intestinal inflammation that gets confused with Crohn's disease; brain and nerve involvement, called neuro-Behcet's, which is the scariest version because it can cause strokes and permanent damage. None of these things on their own scream Behcet's. Together, they do. The eye stuff is the part that scares me the most, looking back. Behcet's can cause something called uveitis, which is inflammation deep inside the eye. And it can cause retinal vasculitis, where the blood vessels in the retina get attacked. Untreated, this can cause permanent vision loss. It can cause blindness. And here is the cruel part. The eye damage happens quietly. You might notice some blurring, some light sensitivity, some redness that comes and goes. And by the time it gets bad enough that you finally see an ophthalmologist who knows what they are looking at, the damage is already done. I lost significant vision in one eye. I will never get it back. If I had known what to ask for sooner, the story might have been different. So why do doctors keep missing it? A few reasons. Reason 1. Behcet's is rare in the United States, so it is not on the differential diagnosis list for most general practitioners. Reason 2. The symptoms appear over months or years, not all at once, so each individual symptom looks like its own random problem. Mouth ulcers, go to a dentist. Eye problems, go to an eye doctor. Joint pain, goes to an orthopedist. Skin stuff, goes to a dermatologist. Nobody is connecting the dots because nobody is looking at the whole picture. Reason 3. There is no test. Doctors love tests. They want to draw blood and get a number that says yes or no. Behcet's does not work that way, and doctors who depend on lab results to make decisions tend to send you home with nothing. Here is what I wish somebody had told me. Keep a symptom journal. Write down every weird thing your body does, the dates, the duration, the severity. Take photos of mouth ulcers and skin lesions when they happen, because by the time you get to a doctor, they will be gone, and the doctor will look at you like you made it up. Bring the whole list to every appointment. Do not leave anything out because it seems unrelated. The whole point of how Behcet's gets diagnosed is pattern recognition across multiple body systems, and you cannot recognize a pattern if you only show your doctor one piece at a time. The second thing I wish I had known: ask for a rheumatologist, not your primary care doctor, not your dentist, not your eye doctor in isolation. A rheumatologist is the specialist trained in autoimmune and inflammatory diseases, and they are the ones most likely to recognize Behcet's when they see it. If your primary care doctor will not refer you, ask why. Ask in writing. Push back. Most insurance plans will cover a rheumatology referral if you explain that you have multi-system symptoms that have not been explained. The squeaky wheel gets the diagnosis. The polite patient who does not push gets sent home with a prescription for mouthwash. There is no cure for Behcet's. I want to be honest about that. But there are treatments that can knock the inflammation way down and prevent some of the worst damage. Corticosteroids for flares, immunosuppressants like azathioprine or methotrexate, biologics like infliximab and adalimumab, which target the part of the immune system that is going haywire. The earlier you start treatment, the more damage you prevent. The longer you go undiagnosed, the more permanent damage accumulates that no medication can undo. That is why the diagnosis matters. Not because there is a magic pill, but because every month you go without treatment is a month the disease gets to keep doing what it does. I am not telling you this story so you feel bad for me. I am telling you this story because somebody watching this video right now has been to 4 doctors and gotten 4 shrugs, and they are starting to wonder if it is all in their head. It is not. Your body is not lying to you. The mouth sores are real. The joint pain is real. The eye stuff is real. And the fact that nobody has connected the dots yet does not mean there is nothing to connect. It means you have not found the right doctor yet. Keep looking. Keep pushing. Bring the journal. Ask for the rheumatologist. Get the eye exam from a specialist who knows about uveitis. The diagnosis is out there. It is just sometimes buried under a stack of doctors who have never heard the word Behcet's in their life. If you have Behcet's disease and you are watching this, hi. You are not alone, even though it really feels like it sometimes. If you think you might have it, please do not wait. The vision I lost is not coming back, but yours might still be savable if you act now. Save this video. Send it to anybody you know who has been chasing weird symptoms for years with no answer. And tell me in the comments, how long did it take you to get diagnosed? And what was the symptom that finally cracked it? I read every single one. I will see you in the next video.